What's this?
Okay, let's see. This is just talking about the format and symbols. Remember on the last one in the ICD-9 we talked about they might have parentheses or brackets or certain symbols to help you know that there's, you know, a subcategory or a subterm associated with it. These as well have a specific format and symbols associated with them. This class is nothing more than an overview of this material. I'm not going to have a test question that says, I need you to find for me the CPT code for open heart surgery with an angioplasty and bypass procedure. That's not going to be on the test. What's going to be on the test is ICD stands for what? CPT stands for what? How many, you know, I might have a question about the alphabetical index versus the numerical index, you know. So don't fret about these slides so much that have all this information about how you're supposed to write it and how you're supposed to find it. Let me tell you, in my last office, none of my MAs knew where to look for that stuff. That's not what they were there for. You actually will have a biller or a coder, or you just send off your super bill that has the diagnosis and let somebody else worry about finding all this information. Okay. But you should gee whiz know what it is, because if they call back and say, hey, I need to know what a CPT code is for this, or your ICD-9 code doesn't match, you'd be like, what's an ICD-9? I've never heard of that. This is why you should at least have an idea. Okay. These are the symbols that are used. They look very familiar, right? The triangle, the bullet, the facing triangles. They were in the last ICD-9 codes as well. A lightning bolt. Right. Lightning bolt, again, that's an attention getter designed to let you know that that particular vaccine that you gave them has not been fully approved by the FDA. So you may have a hard time getting paid for that particular vaccine injection. Sometimes they'll move codes around. They find, okay, maybe it's better if it's in this area, and that's all that is. Saying that's what resequence is. You want to make sure that you're getting paid the most for your most complicated procedure. You should always list it first, okay? And then, obviously, secondary. If you're doing a conscious sedation, you can actually get credit for giving the sedation and then how long they're sedated for. Did you only have to sedate them for 15 minutes, 30 minutes, 45 minutes? Now, conscious sedation is different than anesthesia when you go into an operating room. This could be an IV, but you're still semi-conscious, right? You're like, hello, versus just being, you know, have to have someone who's got the, you know, you've been intubated and you got a catheter when you're in anesthesia. But conscious sedation, if anyone's ever had like their wisdom teeth taken out with an IV sedation, something like that, that's what this is. You're still breathing on your own. You're still can listen when I say open up or close or, you know, stuff like that. Sometimes you have special situations. You can pinpoint that procedure down to a 5-digit code, but it doesn't quite explain the special circumstance. You can put a modifier on that. Again, this is just a way to make more money, right? You get as precise as you possibly can to make the most money. Okay? These actual codes have two parts that you're looking at. How technical is it? And how skilled is the professional? Right? A plastic surgeon versus a general doctor who's putting sutures in. They're both putting in sutures, but I guarantee you a plastic surgeon is going to be able to code higher because they are more skilled when it comes to that. So that's their bread and butter, right? Giving you stitches without scarring you.
Uh-huh.
Right? And again, just like in the ICD-9, there are specific steps. You got to complete the documentation, find out exactly what the procedures were, and then identify the main terms located in the index, and then verify it. And once you verify, then you want to make sure, was there any special situation? Can you put any modifiers in there? I already kind of talked a little bit about evaluation and management. Remember, this is where they're deciding what's going to be the best course of action for you, right? What's the best course of treatment? On a super bill, this is basically where they're factoring the levels of evaluation. Was it easy to come up with that problem or that procedure? Was it more difficult? You know, did you spend 20 minutes with the patient telling them what their course of treatment is, or did it take you 2 hours so they understood exactly what you were talking about with their 15 different medications and how they're going to interact to treat their problem, right? You all know what a consult is, all right? When you ask another provider without them actually seeing a patient. And then outpatient. You go to the hospital to get seen, but you're not actually admitted into the hospital. Anesthesia codes. Remember I was telling you everything's broken down. You have EM, then you have anesthesia. Again, same type of thing. It's broken down to every degree to be able to code, even to the point where somebody's declared brain dead, but you're harvesting the organs for transplant. There's special codes for that. In surgery, surgery is a little bit different. You can have the surgical package where you have one code for everything that's involved in that surgery. Sometimes it's easier to code that way. However, sometimes special situations occur when you're in surgery and you actually have to do it separately. Okay? A lot of times, let's take Dottie's dad for example. He's in the hospital, right? He had his surgery yesterday. All his follow-ups today and tomorrow before he gets released, that's all part of the global period. That's the time when you're still doing stuff associated with the surgery. Checking wounds, changing out the drain tubes, things like that. Still associated with the original surgery. Radiology, same thing. It's based upon the components, the technical component. Lab, medicines, when you give someone an immunization, it actually will have two codes. One for actually giving the medication, and one for the medication itself. So they're not just charging you to give you the flu shot, they're charging you for getting the flu shot plus the flu vaccine that's in there. All right? That's why a flu shot costs 30 bucks or 60 bucks, whatever it costs. I don't know, I get mine for free. But That's why it costs what it does. It's because they're charging you for their time to poke you and the cost of the actual injection itself. All right.